So we have here stethoscope, metric ruler, marker, gloves, mask. Then we're gonna perform a hand hygiene. So good morning, ma'am. My name is Dhared Celiz. So I will be your student nurse for today. I will be assessing your abdomen. So ang purpose of assessing sa abdomen is to identify if there are abnormalities, and there are 4 phases. So there is inspection, auscultation, percussion, and palpation. So ma'am, may I ask if makaihit na ba ka? Okay, lay down. After putting on gloves, place your patient in a comfortable position and expose the abdomen area. Now inspect from side and foot of the bed. Then assess the abdomen. Note the size, shape, and symmetry and condition of the skin. Note abdominal movement, respiratory, pulsation, and peristalsis. Note position, contour, color, and herniation of the umbilicus. Auscultation. Auscultate for vowel sound in each quadrant, starting from the right lower quadrant. Auscultate for bruit over aorta, renal, iliac, and femoral arteries. Use scratch test to locate the inferior edge of the liver. Place the diaphragm of your stethoscope at the second to the last intercostal space mid-clavicular line. Use one finger to very slightly stroke the skin horizontally starting at the umbilicus. The sound will be transmitted to the stethoscope, and this indicates the lower border of the liver. Percussion. Percuss the tone of the abdomen in each quadrant, noting areas of tympany, dullness, or tenderness. Percuss the span or height of the liver by determining its lower and upper border. To assess the lower border, begin in the right lower quadrant at the mid-clavicular line, percuss upward. Note the change from tympany to dullness. Mark this point, it is the lower border of liver dullness. The upper border, percuss over the right chest at the mid-clavicular line and percuss downward. Mark this point, it is the upper border of the liver. Measure the distance between the 2 marks. This is the span of the liver. Percuss the spleen, beginning posterior to the left mid-axillary line. Percuss downward, noting the change from lung resonance to splenic dullness. Blunt percussion for costovertebral angle. Place non-dominant hand over organ. Make fist with dominant hand. Note any tenderness. If indicated, use blunt percussion to assess for organ, liver or gallbladder, tenderness. If indicated, percuss the urinary bladder. Palpation. Palpate all 4 quadrants beginning with a light palpation, then do deep by manual palpation. Note for masses, bulges, or swelling around the umbilicus. Test abdominal reflexes by lightly stroking each quadrant toward the umbilicus. Assess the pulsation of the abdominal aorta. Palpate the liver by manual and hooking techniques. Stand at the client's right side and place your left hand under the client's back at the level of the 11th to 12th ribs. Lay your right hand parallel to the right costal margin. Your fingertips should point toward the client's head. Ask the client to inhale, then compress upward and inward with your fingers. Have the client exhale and hold your hand in place as the client inhales a second time. With deep inhalation, the edge of the liver is more easily palpated. Hooking technique. Palpate by hooking. Stand to the right of the client's chest. Curl the finger of both hands over the edge of the right costal margin. Ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers. Palpate the spleen, kidneys, urinary bladder. Palpate for inguinal lymph nodes. Use light palpation. Palpate horizontal and vertical inguinal nodes. Note size, shape, consistency, tenderness, and mobility. Test for ascites. Test for shifting dullness and perform the fluid wave test. Test for appendicitis. If indicated, assess for rebound tenderness at McBurney's point, referred rebound tenderness, the ellipsoas test, and the obturator test. Ellipsoas test. Ask the patient to lift their leg straight and apply resistance as the patient tried to lift its leg. Place the patient on their left side. Extend the right hip by pulling the leg backward while keeping the knee extended. Pain in the right lower quadrant is also a positive sign. Obturator test. Have the patient lie supine on their back. Place your other hand on the knee. Gently rotate the hip by moving the ankle outward lateral side while keeping the knee in place, which internally rotates the hip. Test for cholecystitis. Press your fingertip under the liver border and the right costal margin and ask the client to inhale deeply. After the assessment, make the patient comfortable and perform hand hygiene, then do aftercare. Then lastly, document the data.